My name is Christina Ross, and this presentation is a review of the article Impact of Lifestyle Interventions on Reducing Dietary Sodium Intake and Blood Pressure in Patients with Hypertension, a randomized control trial. High blood pressure or hypertension is a risk factor for cardiovascular disease. Healthy lifestyle habits have a direct impact on lowering cardiovascular morbidity and mortality. Appropriate dietary intake and exercise are key factors in managing blood pressure in adults. The World Health Organization recommends less than 2 milligrams of sodium intake daily. Continuous care models provide ongoing encouragement to patients and clients. The purpose of this study is to determine if a decrease in sodium in diets along with adding physical activity will have the effect of lowering blood pressure in patients diagnosed with hypertension, incorporating a continuous care model. The methods used in this study include that it was a randomized controlled trial. There were pre- and post-test urinary potassium to sodium ratios and blood pressure measurements. Results were calculated using independent t-tests. There were 50 people enrolled in the trial, 25 people in the control group, and 25 people in the intervention group. The study was conducted in Iran, and it lasted 4 months long. In the control group, there were 15 men and 10 women, and their median age was 55 years old. In the intervention group, there were 14 men and 11 women, and their median age was 58 years old. Other patient characteristics that were looked at included education level, employment status, and length of time diagnosed with hypertension. If you are interested, you can see that information on the poster in Table 1. Both the intervention and the control group were given orientation at the beginning of the trial and evaluation at the end of the trial. During these times is when sodium levels and blood pressures were measured. The interventions consisted of 8 lifestyle education group sessions lasting 1 hour each, dividing the intervention group into 2, so 12 people in one group and 13 people in another group. And then there were 12 individual consultation sessions that focused on continuing healthy lifestyle and treatment. Both of these interventions were provided by a nurse pursuing her master's degree, or his master's degree. The results for the control group were a decrease in both systolic and diastolic blood pressure by just 1 millimeter of mercury each, and a slight reduction in dietary sodium. The intervention group had a significant decrease in systolic blood pressure by 16 millimeters of mercury, decrease in diastolic blood pressure by 19 millimeters of mercury, and a decrease in sodium level by 7/10. Exact numbers can be seen in Tables 2 and Table 3 on the poster. Conclusions drawn from the study include the continuous care model was effective. The intervention group had a marked decrease in systolic blood pressure, diastolic blood pressure, and urine sodium levels, all indicating effective interventions. Nursing implications are as follows. Implementation of a continuous care model influences people's dietary sodium, helps them make healthier lifestyle choices, which directly impacts lowering blood pressures. Proper education brings conscious awareness to a person's daily habits that might not have been considered. Choosing healthy lifestyle habits such as exercise or choosing not to smoke impacts someone's health status. Excessive consumption of sodium causes blood pressure to increase, directly increasing the workload of the heart and raising blood pressure. Nurse practitioners can teach patients the positive effects of physical activity and appropriate dietary habits, and this can improve the health of their community. There's a list of references. Thank you.